Thinking. Hey, everybody, we are live. Welcome back. HawkTalk Live, episode 3. As you can see, we're here with Dr. Bernard Kim, a chiropractor, and Jacob Parga with Iridium Sports. We're going to give people a few minutes to show up per usual, so feel free to sit down, get comfortable, and check out the slide if you want to know more about our guests. Give us maybe about one more minute and we'll get started. Thanks. Thanks for coming back for most of you guys. Just a reminder, actually, we will be giving away a prize at the end of the webinar to a random attendee, which is pretty cool. Also, if you want to receive a t-shirt, a HawkTalk t-shirt, please don't forget to share the webinar information, the webinar link, and hashtag HawkTalk Live. Hey, there you go. There's the information. So share on social media, hashtag HawkTalk Live, and we will contact you to get your information and send you a shirt.
Make sure you guys do it.
That's Jacob.
Shirts are awesome and super comfortable.
They are super. The new ones are so comfortable. They're so soft. Yeah. I took my husband's away because I like the man's shirt for sleeping, so he doesn't have one anymore.
Oh, man.
Also, for those of you guys who are signed in, hello, we're big again. For those of you guys who are signed in, don't forget we have chat enabled. So if you have any questions for myself, for Dr. Bernard, Kim, wave your hand. Sure. He's there in the middle. Or Jacob with Iridium Sports. Please feel free to put a message on there and we'll either answer you during or after the webinar. So first, thank you guys for coming, both of you. I know that each of you has very busy schedules. Jacob, you're off to New York. Bernard, you are busy trying to get some things started up and going on some new adventures. Why don't we hit Jacob up first? Can you tell us a little bit about yourself and what you do, just for the public?
Yeah, so hi guys, my name is Jacob Parga. I am a sports agent for the Iridium Sports Agency. I also am the director of marketing for the agency, which actually brought me to this webinar actually. So my job at the Iridium Sports Agency, I handle all the endorsements and all the sponsorships for our athletes. We have over 120 athletes, professional MMA. We also have football as well. So we have guys in the NFL. A majority of our clientele is in MMA. The company's been around for about 8 years, started by our CEO, Jason House, and our partner, Jeremy Luchow. Jason started it right after law school about 8 years ago and has built this empire. I actually graduated from his alma mater, so we both went to the same undergrad, and we met probably about a year ago, and yeah, we've been working ever since, and since then, it's been a great relationship. I love working with our athletes and stuff like that, but how I got brought to HawkRips, well, I was obviously looking for good companies to work with our athletes, and we were trying to give our athletes the next cutting edge, whether in training or rehab and things like that. So saw the product online and reached out to Sean McNeil, who's the CFO of the company, and got some discussion going. And then he connected us with Kate, the lovely lady here. And, we started brainstorming some ideas and getting some stuff together. And we got to set down to Southern California. I didn't really know what to do with it. So we brought it over to our main doctors over at OC Fight Docs, which is where Dr. Bernard has worked for how long is it now, Bernard?
I was there like a year and a half.
Okay, yeah, so he's been there about a year and a half. Dr. Bernard is amazing. He's helped our athletes with the HawkRips tool, with the Techer therapy, who we've also will be discussing today. And yeah, so that's pretty much what I do. We're constantly trying to dedicate our days to giving the best opportunities to our athletes, whether it's in the cage or whether it's outside of the cage, and that's what brings me here.
Jacob, you just take numbers and names. Jacob's an amazing person. I've been working with him, and he just makes things happen. And Iridium Sports Agency has been amazing to work with as well. So I just want to thank them right off the bat for joining us today, and thank you for representing Jacob. Dr. Kim, why don't you just say a little bit about yourself, and then we'll go into some of the clinical aspects.
Yeah, so I'm a chiropractor. I was working at OC Fight Docs or Kessler Family Wellness in Tustin California, up until about a month ago. Unfortunately, I wasn't able to renew my work visa, so I'm back up in Vancouver, Canada, where I'm originally from. But it was an awesome experience there. Right at a chiropractic school, I was able to work with professional athletes from NFL, UFC, Bellator, NCAA, you name it. And so early on in my career, so yeah, just crazy experiences. And yeah, a lot of it has to do with Iridium and dealing with Jacob and Jason House. They were actually the ones that connected OC Fight Ducks with Hot Grips. And you want me to talk about how I found out about Hot Grips right now, or should I?
Yeah. So basically, I'm both an instructor and a clinical educator, and the education coordinator and the webinar person. But I did a media day with these guys back in January, which we'll show you a few clips in a few minutes. And Bernard and I worked on a couple different athletes, and I can tell you, thanks to Jacob, it was just an amazing experience to see the transformation that these athletes had in such a short period of time as well. And Jacob, if you could share your experience, what you've seen in the athletes since they've started Hawk Grips treatments more regularly, that would be awesome. And then Dr. Bernard, you and I will go into a little bit more of a clinical detail, including the videos with the Tecker therapy and the Hawk Grips tools.
Yeah, so pretty much the media day was a day that we dedicated to obviously having a larger treatment day for a large group of our athletes. Brought out probably about 20 or 30 athletes. It was actually a really big turnout for us, and we had Dr. Kim, and yourself working on our athletes, using the Tecker and the Hawk Grips, and when they went in right after practice. So these guys were already beat up. They do a full track workout on Saturdays with sparring. So obviously you can probably imagine what kind of injuries or just things that they go through being an athlete. Lower back pain, shoulder injuries, neck injuries. Those are pretty common within the sport of MMA. And we had guys going through and showing up and like, man, well, this hurts, that hurts, and Dr. Bernard and Kate, you guys were able to really alleviate a lot of their stress. A lot of them had a lot of stress headaches because of the pain. We're having a lot of lower back issues. A lot of my guys were walking out of there like, man, I could go in for another training session. So, yeah, no, the media day was amazing. I think my athletes are starting to see some of the long-term benefits, of working with the tools, alleviating certain, preventing certain injuries from happening, that a lot of times without tools like these, athletes do suffer in this sport. So, yeah, that was kind of just the synopsis of the day. And I think as we kind of go through, we can kind of explain a little bit more in detail who the athletes are and what we're doing with them.
No, that's awesome. And I know that we've used the tools on you a few times too. Jacob, isn't that right?
Yeah. So Jason House and I, we're kind of we're usually the ones running around and doing everything with the athletes. So our bodies kind of take a toll. We're constantly on the road or flying or doing whatever to make sure that our athletes are getting taken care of. We spend there's 864,000 seconds in a day, and we're probably dedicated to our athletes at all times. So it does take a toll on our bodies, but I know that I've had the Hawk Grips therapy on my back, and some of I hurt my back a while back training, and Dr. Bernard was able to use some of the tools on me, the handlebar tools, and really get into the lower parts of my back and my piriformis and all those lower half muscles that were just so tight. And I had some great turnaround. Jason House, he actually trains jiu-jitsu as well. So he was doing one of the moves and tore his pec. And there was insane bruises on his chest. And with one treatment, you could imagine, like, it was crazy. Like, he looked black and blue. And then the next day, the color was like, his skin was back to normal just because of one treatment that he went through. He's done it on his hip. Dr. I don't know if you want to talk about his issues with his ankle and like what you were doing treatment-wise to kind of bring him back.
We real quick, a lot of what people don't know is that you can treat with hawk grips from day zero to from day zero to chronic injury. What I do want to jump on, if you don't mind, Dr. Menard, we're going to show a video in just a few seconds. What happened part of the media day, we brought in Chief Congo with the windback technology. You used that on one of the fighters, Russell. You can talk about that one in the video.
Rust coming in with burner, stinger type symptoms. So usually, you can see on my right hand there, I had a bracelet on, and so that's what the checker machine is. So what it is, it's an energy or a high frequency energy current that helps to open ion channels at the cellular level. So it increases intra and extracellular exchange with benefits like increasing endorphin secretion up to 48 hours. Revascularization helps to just warm the tissue for fibrosis and things like that. Capsular helping to increase range of motion. So you can actually, with is a bit of heat coming from the tool. There it looks like I was doing some sweeping strokes through some of the gristles. Yeah, so it's a French technology, and how OC Fight Ducts got introduced to that was from the UFC, now Bellator fighter Czech Congo. It was an integral part in just, I mean, he's an old man. He's 43 years old and he's still fighting. He actually just got a first round KO last week.
Yeah, he had our T-shirt on. That was pretty cool on the weigh-in. So I was just informed that during the video, it got cut out, so we couldn't hear anything. So basically, in the video, he's using the handlebar, using some sweeping strokes on the upper trapezius muscle, and the checker is the bracelet that you can see. And what he was saying is that energy is translated through the practitioner to the patient. And Bernard, if you could just go over one more time what your purpose was and how you incorporate the Tecker and the hawk grips instruments, how that is beneficial to the patient, because for some reason the sound cut out. So if you could just...
What it is, it's a high frequency electric currency that goes, it helps to open up the ion channels at cellular level, so it increases intra and extracellular exchange. So some of the benefits with that is it can increase endorphin secretion up to 48 hours following treatment, and with revascularization helps to heat up the tissue. And so that frequency is going through the practitioner's hands into the tissue. So you can do things like ART, combining like the active release technique style, the pin and stretch style to the hawk grip tools themselves, to like the current will actually travel through my hands into the tool and then into the area we're treating as well. So yeah, you're really just incorporating the hawk grips protocols with the Tecker. Really, you can save a lot of time. And
how does that feel for you when you have that?
Yeah, so sometimes you could feel like that warmth of around the wrist as well, but it really just kind of lets you know it's on, and then the patient will also feel that heat with the tool. With the hands, not so much, but with the tool, they can definitely feel.
No, that's awesome. So not only you're addressing, basically you're addressing healing and treating from the cellular level, and the tools themselves kind of broaden your, it's a word I'm looking for, mom brain strikes again. Your surface plane is increased, the area that you're treating. So the energy is going to be translated not just through your hands, because you can use the Tecker without the tools, of course, but with tools such as the handlebar, the scanner especially, it can be translated to a wider treatment area, especially with muscles such as glutes, traps, lats. Those are very large surface areas. And so using them in combination can help expedite manual therapy treatment, and getting twice the benefit in half the time is basically what we're addressing.
Yeah, no, that's a great point. Like when it's pretty tough on the practitioner sometimes if you're just, using your hands for those big, broad muscle groups. So definitely using the hot grips, it's almost necessary to just, save your lifespan as a practitioner clinician.
Career longevity is huge. I mean, I use the tool straight out of graduation, kind of like you. I just jumped right in. And I did manual therapy at the Veterans Clinic with specialty clinics, things like that, all day, every day, sometimes 9 to 10 hours. And it really does wear on you. But with the tools, I still have no issue after working with patients day in, day out. Is there anything that you want to comment on the Tecker therapy, the HawkTalk treatments, maybe what you see in comparison with how it affects the fighters in a positive way, how it preps them, and as Jacob said, before and after prevention and treatment, how that combination therapy has worked out for you?
Yeah.
For athletes specifically, I mean, because I know we can treat chronic conditions, but I know you probably see with these athletes a lot of very acute injuries or reoccurring injuries at the same time.
Yeah, lots of times we're treating multiple things at once and prioritizing, the worst thing, the thing that's most debilitating. But what's been so great with hot grips in particular for comparing all the different ISTM companies out there is the protocols. So one of the main things in episode 1, Sean Berger was actually mentioning this. One of my mentors was Tom Hyde and Greg Dorr. And I believe, is Greg Dorr still one of our instructors as well?
Technically, he's on the roster, yeah.
Okay, awesome. Yeah, so a lot of his protocols revolve around position of provocation. And so you kind of evolve that into movement of provocation, adding a resistance or load to the tissue, functional movement or functional motion, and then also a proprioceptive component to that. And so really a lot of our patients, I guess, at least probably 30% of the time when we're treating sprains, strains, tendinopathies, we're using, for example, the smaller surface area tools. Like this is probably my favorite, the tongue depressor. And you can really get into those areas, pinpoint them, and obviously combining the Tecker with that, you're just doing so much more. But causing microinflammation to those areas and using kind of that step-by-step protocol that Hawk Grips kind of lays out so nicely in our courses. It's just been, we've seen, there's really no other style of treatment with the ISTM. There's a lot of people in school that just see a couple demos, like even in that demo video of me, it looks like I was just kind of doing a pretty basic stroke there. And that's just one example of a sweeping stroke that we do. But for other scenarios or other conditions, you'd be getting a little bit more specific with the type of strokes. And
what's really cool is you start to learn, once you have that basic knowledge, level 1 and more advanced, working with what we call active recipient patients, where they're actually doing the exercise in the position of provocation, that sort of thing. You can start to brainstorm, such as with the Tecker, and combine treatments to get even more benefit. I mean, I've seen people combine it myself with electrical stimulation. We've seen it done with ultrasound even. I mean, the possibilities are really endless when it comes to ISTM. And what I like about HawkRip's instruments, because I started on a different type of instrument before I started working for Hawk, I'm not going to lie, they are much easier. They stay in your hands, and they work with the other modalities much better than some of the other brands that are out there, I've noticed. And that's kind of the feedback that I've gotten from a lot of clinicians, is because of the grips, because of the quality of them, they do much better with things such as the Tecker, which is why we work with Mr. Congo. Does anybody have any questions? I'm going to put it out there right now. I know we have quite a few people in the webinar. Does anybody have any questions in regards to specific treatments, injuries with athletes, Iridium sports, any kind of clinical inquiry? There might be a little bit of a delay as well. I'm going to show the video one more time so you guys can see the bracelet. That's the Tecker. And we have just a very short clip. We're going to show it one more time, and he'll be working with our handlebar instrument. Bernard, you want to hold up the handlebar? Yeah. Awesome. Yeah. So that is the newest version of our handlebar. I love it. You can see the little nods in there. The nodules right there can get into areas such as right near the acromion. I mean, It's really, really awesome. You can get into small spaces. The video is about to play, so you'll see how he uses that instrument with the Tecker to get, like I said, a more broad surface area treated. And then we'll take some more questions. So what's really cool is, again, it's just kind of enhancing the ART, enhancing the iStim. I know that was the big thing. Now, Dr. Bernard, I don't know if you have experience on this. I do, but with the electrical stimulation and the tools, have you used that combination?
I've seen it, not too much. I haven't done it myself too much, but definitely believe in benefits, and I'm probably going to be incorporating it a lot myself.
So we have somebody that kind of asked a question in regards to electrical stimulation and Hawkers. Hi, Casey. Myself, I've used it. I used it at the VA location that I worked here in the outpatient and inpatient, actually, in San Diego. You take one of the leads, just like you would use in the ultrasound eStim combination therapy. One of the leads would be attached to the tool itself, and you would use the tool with the lead attached on your patient. So just like with the ultrasound head, it moves around the area, providing the ultrasound treatment and electrical stimulation treatment with a passive recipient patient. Moving around the treatment area, same kind of idea. So you would essentially hook up, like I said, one lead to the Hawkers tool and turn on. Be careful, obviously, you want to have some kind of glove on so you don't get that shock as well, but using that to connect the current to your patient. So we have a question, Dr. Bernard, I'm going to let you take this one. When you use HawkTalk instruments by themselves, how long are the treatments typically? And how do the treatment times, or are the treatment times different when you combine it with WinBack? That's actually a really good question. As for the treatment times, I would absolutely recommend taking courses to understand that it's going to be patient specific. Some patients we're going to treat for 30 seconds. If they're more acute, some treatments are going to be a couple minutes if it's a broader area and a more chronic injury. But with the WinBack, do you use the same time frames that you learned about in the courses?
So, I mean, I've learned typically it's like 30 seconds to 2 minutes, depending on what the condition you're treating is. But with the Tecker, the only thing is you have to set the time on the machine for how long it goes. So you don't need to necessarily use the tool the whole time. You can switch from the tool back to your hands. But typically, I would be a little bit softer with the Tecker treatment and treat a little longer than maybe up to 3 minutes, but at that point, maybe switch to my hands while still having the bracelet on.
Gotcha.
But kind of making sure you're still getting that afferent information through the tissue.
No, that's a good question. We have another one. Jess, hey Jess, how you doing? Feel free, Jacob and or Bernard, to chime in on this one. What's another modality that you, Jacob, in your case, what you see used with your athletes, and then Bernard, that you necessarily use with your athletes, especially the fighters that you guys see and treat? The combination therapies.
I know. I don't know all the correct terms, so Bernard, you're gonna have to help me on this. But I know that the handlebar is obviously the reason why I know that one, because they do use that a lot on our athletes. I think lower back injuries, middle back injuries, shoulder injuries are probably one of the bigger issues in the sport. These guys are taking so much load on those lower muscles, on top of their weight training, on top of jiu-jitsu and all this stuff. You're getting yanked and pulled in different ways, so your neck, lower back, and shoulders. Whenever my guys go in there, I know we were doing a lot of work with Cheeto Vera. Cheeto was getting the handlebar on his neck as well as doing we were working on his foot, right? And his
a whole bunch of things.
Yeah. So honestly, there isn't one specific tool that is. I think all of them are great. I think all of them have each specific way of helping my athletes. I know with Cheeto, they were able to open his gait a little bit more with how he walks and fix some issues there. We changed the dynamics, a full punching dynamic with another one of our athletes, with Desmond Torres. I know he was having some shoulder blade issues, and Bernard was really getting in there and really opening up the scap, alleviating some pressure on the labrum and things like that. And his whole punching dynamic changed. So, Hawk Ribs, Tecker, all of it is amazing. They've helped my athletes not only injury prevention, but make them even better in their everyday training.
Awesome. Bernard, what about you?
For that, I guess kind of continuing on with what Sufasoni, I think that's how you say your last name, right, was talking about in episode 2, combining like cupping too, just with like fascial distortion, making sure that you're getting the kind of decompression, pulling the fascia up as opposed to all that compressive tissue we usually do with like an stretch again or with the ISTM, but also incorporating another modality. Just I feel like percussion therapy has been kind of the hype the last couple months, maybe since HyperIce released that new Hypervolt, and Theragun's been out in the market for quite some time. But especially with the Hawk Grip protocols and incorporating kind of that proprioceptive component. I mean, at OC Fight Docs, we have a vibration plate there, so we'd be using that a lot for kind of the end stages.
That's awesome.
Yeah, but if you don't have
we need a video of that, doing Hawk Grips on the vibration plate. I don't think I've seen that yet.
Yeah, no, especially like mixing in like eccentrics and stuff while you're on that. It's just you're totally overloading and getting that, stimulus through the tissue. So.
And I loved her idea of periodization. I can't get over that. I've been really looking more into that with the Hawk Grips treatments, the idea of cupping and mixing the different treatments together. Jacob, we're going to have to give you to Dr. Kessler to put on that plate since you're there into the Tustin area still. Get you vibrating on the plate with some videos so we can share with these people what we're talking about.
We'll get it filmed up whenever you guys need it.
Awesome. Well, I'm going to get ready to close out. I'm going to try to stick to my half-hour deadlines each time. I know that the past few I've kind of gone over. I don't want to take up anybody else's time. Jacob, I know that you're going to New York, so safe travels for you. Is there anything else that you want to say to our audience, if there's athletes out there, or just anything that you'd like to say about anything?
No, we're good. Thank you guys so much for being here. If you guys want to give us a follow, we're on you can reach us at iridiumsportsagency.com. We're on Facebook, Twitter, Instagram. You can find us all at iridiumsportsagency.com. Give Dr. Bernard a follow, OC Fight Docs, Kate. I recommend this to any athlete that's looking to just prevent some injuries, or if you're a clinician or whoever works on you. If you want to get them involved with this, please reach out to us or whoever. Get you guys squared away.
Awesome. Jacob, I absolutely love working with you in Iridium Sports, by the way. So thank you so much for doing this. You guys are absolutely amazing, and I'm so excited for all of the things in the future. And Dr. Kim, I want to just ask really quickly, we have a question in regards to, I know that the Tecker can be used for scar treatment. I want to jump on that in the last 2 minutes. It can kind of be used for scar treatment, correct? I've heard a lot of good things about it. Do you use ISTM to treat those scars, those fascial scars?
Yeah, I mean, I would probably stick with more like feathering type strokes, just for more like the revascularization to the area and getting more of like using the broader tools maybe for that. But yeah, you definitely can. Just got to be careful.
Yeah, I really want to emphasize, and I think Doc Kim, you might really have my back on this. I know that some of the videos that are out there make ISTM look easy, but you really can't use that, especially ISTM alone or in combination with Tecker, with eSTM, with anything like that, all willy-nilly without being educated, because there are restrictions and contraindications and special treatment applications for each. You wouldn't treat a chronic scarring the same way as you would treat an acute injury, for instance. And it seems like an easy concept to understand, especially for us clinicians out there. But if you don't know how to use the different strokes, the different pressures, the time in a correct manner, there's really put the patient at risk. So I just want to emphasize, if you are not trained, I am also the education coordinator. I can get you guys hooked up in a class. or feel free, you can host a class if your location, if your clinic is interested in hosting. Bernard's an instructor up in Canada, so if we have some Canada people on the line, he will be likely teaching those. And we have instructors all over the nation, worldwide even. If you'd like to host a course, let us know. We're going to have some slides up. We have information on the win-back that Justine, our moderator, is putting up for you, so you can learn more information about that. And again, I'm so grateful that all of you guys joined us. Dr. Kim, thank you for taking the time up in Canada. I'm just happy we're all in the same time zone. This worked out quite nicely. Next week, we will be talking with Dr. James Wagner. He's such a smart man, a good friend of mine. He's an occupational therapist, hand therapist. So if you have not signed up for next week, please feel free to do that now. And we'll keep you updated on everything else in the future. Again, if you have not shared and you would like your shirt, share your shirt. Hashtag HawkRipsLive or HawkTalk Live, excuse me. And it was just a pleasure talking with you guys, and I will keep in contact with you both. Thank you so much.
Thank you guys. Have a great one.
Bye.